on behalf of Indo-American Chamber of Commerce, all my speakers, Dr. Trehan. Actually, I am really happy to see you again. We are meeting on various different platforms, and I am really getting lots of insight from you because you are working on a very, very high scale. So welcome you all. And today our topic is how India and America can work together. So I think that India and America can work together to create more safe healthcare, and which is full of latest technology and mixture of modern science with the mixture of our ancient form of Ayurveda, Yoga, Siddha, Unani, etc. And both countries can work together for best healthcare for all. As America is doing very great job in form of, if we talk about technology and new equipment, so software development, they are doing actually wonderful. And we are having skilled man staff, young generation who are, because India is full of young people. So we can work together and we can create lots of good things. With these words, I will not take much time. I would like to invite Mr. Gaurav Pandey. He is a technology and healthcare professional. He has been working with various patient communities in India and abroad. He has extensively worked with WHO, UNESCO, UNAIDS, UNDP, and various other UN agencies in the public health domain. He has forefront the development and deployment of many successful tech-enabled solutions for public health and telemedicine space. In addition to public health, he has worked for the promotion of the medical tourism industry in India in collaboration with many leading hospitals. He has organized various medical tourism exhibitions, OPD surgical camp, showcasing India's medical expertise and extending helping hands to patients seeking advanced treatments and elective surgeries outside their countries. He has worked with many medical associations in Africa to educate and support patients to take care of their health during COVID pandemic times, including Ethiopia, Tanzania, Nigeria, and Somaliland, etc. His company has been setting telemedicine kiosks in many hospitals in Africa to provide single window access to the Indian healthcare system. Currently, his venture is managing one of the largest public health data warehouse solution in the state of Uttar Pradesh. Gaurav's venture has also developed India's first healthcare mobile application, which intend to offer all the healthcare services under one umbrella, ranging from health profiling for primary and preemptive health, online medical consultation, treatment booking, services at Indian hospitals, ordering medicines, pathology, booking services, etc. His solution intend to complement the government of India's National Digital Health Mission and aims to serve a large population base in India and abroad. So I welcome Gaurav, and I really wish to listen lots of good things from you.
Thank you very much, Upasana ji, and it's my pleasure to speak and present my views to such a distinguished gathering. Good evening, everyone. This is Gaurav Pandey. Healthcare, of course, we all are, recovering from the effect of COVID, and COVID pandemic has not only taught us many lessons, but it has done a very good thing, which is, bringing back the health on the priority area. This year has been a very significant year for India as well, because we have just completed 75 years of our independence, and we have entered to the 25-year of journey of Amrit Kal, wherein Government of India has presented, the Honorable Prime Minister has presented their vision to introduce or establish India as amongst the category of developed nation. And we all know that health is something which is going to become the engine for the entire growth journey. An unhealthy nation can never be a developed nation. A collaboration from developed countries such as US, knowledge transfer and knowledge sharing will indeed be playing vital role in the entire journey of this Amrit Kal. And we as Care Connect Healthcare Services, we are also committed to complement the government vision and aim to work with communities in private space, in public health space, to ensure that India's journey towards achieving higher standards of health is achieved, and we set, our goals in a such, scientific manner that we know how to, fulfill the gaps, challenges, and, demand supply issues. Healthcare primarily, because again, every other sector is evolving, so is the healthcare. And now the time has come when we as a healthcare company or other, healthcare startup, instead of working just as a matchmaker between a care seeker and care provider, should try to, add more value, more, protocols, more SOPs in nature, so that every patient, every subscriber should get a unique experience of healthcare services. Our healthcare mobile application, which we have developed after an extensive research and endeavors of 2 years, which is which is a combination of technology, which is a combination of medical expertise and know-how, and we start our subscriber journey at any stage of life, and we intend to become their lifelong care partner. And every year we want to present them what are the areas of improvements which they should look into, what type of medical intervention they would need to ensure that they are in good health always. So the unique thing in our healthcare offering is that we do not compete with the existing healthcare providers. We are rather aggregating all of them so that it should be an equal platform and opportunity for all of us to contribute towards the healthcare journey of India. We know that demand is so big, a country of 1.4 billion population. We know that people would need, pathology services. They would need, continuous supply of medicines, drugs. We know that they would need, medical expertise from various specialties. They would need treatment assistance from various hospitals. And this is the time wherein we need to empower every stakeholder in this entire healthcare journey. If the patient is empowered, they will always be in a better position to communicate their problem in much precise manner to the doctor. Same way, if we are empowering our doctors and the hospitals with complete profiling of a patient, their quality of advice, their quality of treatment will always be much better. So instead of establishing a transactional relationship between a patient and a doctor, a patient and any other service provider, it is the time wherein we add values, we add standardization, and we become a bridge between care seeker and provider in a very scientific manner. Today, in the era of artificial intelligence and machine learning, we all know that there is a dearth of doctors. We all know that we are working towards achieving the goals of 1 doctor per 1,000 population as per WHO standard. But at the same time, we also know and realize our limitations in filling the gap. It is the high time when we start using technology, intelligence built out of data, and more accurate analysis of the data. It is the time wherein we make our entire ecosystem so intelligent and so smart that the shortage of doctors, shortage of quality manpower can be complemented well with the technology. Our mobile application is developed in a manner wherein every subscriber, when they enter into the healthcare application, they are treated well, and they are treated very uniquely. 1.4 billion population of India is basically a 1.4 unique cases of every individual. If the data related to their health, which could be a form of their comorbidity or pre-existing data, their family history, their past illness, any past procedure which they have undergone, which has a possibility of reoccurrence of the problem, any allergy which they have, same way, any type of medication which they are taking, it is important to compile every data in a very accurate manner. And whenever they have any medical issues, that data should be supplied to the service provider, to the doctors, to the hospitals, so that a patient's translation of information or transmission of information is very organic and hygienic in nature, and the quality of care will always improve. Another area which is needed, we all know the challenge which our country is facing, not with the doctors, the quality and ethical issues also. We know that India is also, probably one of the largest marketplace for spurious medicines and drugs and various other fake products. So we need to, work out the model which Twitter uses is like a blue tick system, wherein like we are only working with the verified service provider with a pan-India offering, and those credentials, those background, their credibility is like undoubtedly matching the international standard. We all know the price of medical expenses or the cost is going high by every day, and the inflation is resulting in people's dropping out the continued care journey. It is the important aspect of our services when we support our patients, our subscribers, to optimize their medical expenses by offering alternative treatment plans, by offering substitutes of drugs and medicines in form of branded generic products or lesser expensive medicines available from various brands, so that they enjoy saving in their medical journey, and they should always feel motivated and encouraged to continue with their care journey. It is also very important offering to all the stakeholders. When I talk about the stakeholders, I am actually talking about the demand side. Given the size and the demand, we as a healthcare company, actually, we need not market ourselves. Even if like collectively work together, even we will have shortcomings in our offerings. So it is important that we position ourselves a little bit differently. So we as Care Connect, we work with the patient side. We work as a demand side. We work with the RWAs, we work with the institutional clients, we work with the corporate clients, we work with the clubs, communities, and we collect information and we compile it them, and then we link that demand with the supply. And that is something which is being well appreciated by our partners, by our subscribers, because every unique need is of our subscriber is met with the right set of service providers. It is healthcare can never be a commodity which can be offered or which can be serviced with offering price cuts or discounts or some other mechanism. Every situation of a case, every unique case should be dealt with great human values, great standardization, so that they should feel happy, they should feel healthy when they are connected with us. We are also working and aligned ourselves with the government's mission of digital tracking of healthcare journey of every individual. So every transaction which they make with our application is a connected transaction. For example, someone is coming and taking medical consultation, then buying medicine, then undergoing pathology examination, seeking second opinion, being referred for a surgery. The entire transaction is a connected transaction, and the entire journey has to be mapped in a manner wherein like a predictive analysis or predictive future problem can be established, which can be used as an education tool for the patient and can be used for the supplier empowerment. So these are the various services and offerings which we are doing through our mobile application. We have also added the devices from the telemedicine kit, which is helping our people to create evidences at the point of sales devices or IoT devices, and to transfer that information back to the doctors or the hospitals at remote location. These integrated telemedicine devices are also helping people to keep a track on their vital organs for their heart health, for their kidney health, for their hypertension, diabetes, because we as an Indian population, we are also having a habit of leaving our treatment journey midway. Another value added feature which we have added is whenever people come and buy medicines, there should be some alert mechanism which is inbuilt with our system, so that the most common problem which we are facing and which are unfortunately unnoticed is like we don't know about antibiotic resistance, we don't know about drug response, we don't know about drug resistance and various other problems. We have a habit of undergoing self-medication. A patient education in this regard is very much important. Care continuity support is very much important. That's how our entire healthcare application ecosystem is developed in a manner that people should feel connected, people should feel healthy, people should feel educated also, and people should remain with us throughout the journey. So that is the model on which we have been working. We have launched our application and services to various in-house corporate clients last year, and we are now planning to go to public, and we want to make it a real successful journey. And we want to, again, be a part of this growth journey of India during this Amrit Kal with the able support of our partner network, the leading hospitals, the doctors, the pathology service providers, the pharma providers, home care at home services. And that is the bundled and a connected approach. And that's how we may named our venture as Care Connect. So that is from my side, Upasana ji. Thanks to you for giving me this chance to share my views.
Thank you so much, Gaurav ji. You very well said that we should not work as a care seeker and care provider. We should do more. So with these words, I would like to invite our next speaker, Mr. Bhanu Prakash Kalmar ji. Bhanu Prakash is a partner and national sector leader, healthcare and pharma. He also leads the risk practices of South India for Grant Thornton India. Bhanu is a member of the Global Life Sciences Group and Global Governance Leader Group of Grant Thornton International. Bhanu is a chartered accountant, has qualified CISA exam, and has completed Executive Journal Management Program from the Indian Institute of Management, Bangalore. Bhanu comes with over 20 years experience in risk consulting and specializes in the area of corporate governance, risk-based internal audits, enterprise risk management, and business process reviews. Bhanu has advised and assisted many listed MNC and large private companies in healthcare and pharma sector, covering API formulation, CDMO, contract research, multi-specialty, single specialty hospitals, IVF centers, and third-party administrators. He has authored several articles on corporate governance and is a regular speaker on corporate governance in various forums. Bhanu is actively involved in advocacy of the internal audit profession. He has held the position of President, the Institute of Internal Auditors India, Bangalore chapter. Bhanu has advised some of the industry leaders in healthcare, pharma, and IT sector to strengthen governance, implemented robust control environment, cost saving, and business process efficiency measures. So Bhanuji, now around 5,000 viewers are watching us and listening us. So kindly you tell them what is really needed in industry right now. Over to you.
Thank you, Upasana ji, and IACC. It's a privilege and honor to share my views. Good afternoon, ladies and gentlemen. When I was thinking on what to talk in this forum, this thought of the Shah Rukh Khan's dialogue in Chak De came, where he motivates people, motivates his player for 7 minutes. So I have 7 minutes. I'll try to do my best in the 7 minutes what I can cover on why wellness makes a business sense. We all know the importance of wellness as individuals, as community, as entrepreneurs. I thought I'll bring in some quantitative dimensions to it. I'm an accountant, so we always try to see how we can prove that our hypothesis with numbers. So we'll see a lot of numbers around it. I'll cover a little case on why it makes as a business sense from healthcare to wellness. I've intentionally kept away from the clinical side of it. There are many clinicians in this platform, and I think they will do better justice on this. So I have a short presentation. I'll just sort of cover this. Just give me 1 minute. Okay. Able to see my screen?
Yes.
Okay.
Yeah.
Thank you.
Yeah.
Thank you. I think first, what I've done is I've sort of structured in terms of giving some perspective on the demand and supply side of why healthcare to wellness, what government is doing today, what are the opportunities for private, what are the investments that have happened, and how India and US can collaborate. I have used various sources in this presentation. I truly acknowledge the sources. These are not necessarily my views on the numbers. I think if you really start from the factors promoting wellness, I think the biggest change we are seeing today is the shift in purpose and priorities of life. There was a time where wealth was the purpose, the priority, but I think that's shifted a lot from wealth is one of the priorities, but the other priorities are health, family, relationships. I'll emphasize on health. I think that sort of brings in a lot of focus on the wellness. So there is a paradigm shift in people attitude towards health. I think that's also driven by the millennials who are focusing on a healthy life. The advances in the medical field are helping a lot on the predictive side to sort of assess or identify the challenges well in advance. Of course, the increase in disposable income, which sort of enables people to sort of focus on the wellness aspect. There are various government and corporate programs. And I think the last but not the least is the technology. The technology is definitely playing a significant role in how we can focus on healthness, on wellness, and that's something on the demand side. I thought I'll give something on the demand side now. Something a little bit on the supply side, why it makes sense. If you really look at today, India's healthcare system, I've just projected a few numbers. It doesn't mean that the importance of healthcare doesn't go away. It does, but in addition, why it makes sense for wellness as a business sector. Today, if you see in India, there are around 20 lakh beds for 100+ crore people, and the urban-rural divide of that is urban has 65%. Rural has 35%, government has 40% of the beds, and private has a 60% of that. So if you really look at today, the number of beds versus the number of people, definitely we need to have more wellness programs to ensure that the load on the healthcare system is lower. 20% of the people are covered by private insurance, 50% by the government, and another 30% still is the missing middle. So, again, a healthy lifestyle ensures that it does not impact the income of the population. I think that's, you'll see on the left side, today, 12% of the household debt is on account of healthcare expenditure. The out-of-pocket expenditure in India is around 63 to 65%, whereas globally it's only around 18%. That means an individual spends 65% of their savings towards healthcare expenditure. These are law of averages. Of course, the growing, increased incidence of lifestyle diseases. Today, 1 in 4 Indian is suffering from hypertension, 1 in 10 on diabetic, around 14% on cardiac ailments. So these are the aspects which actually, makes us to really look at how we can promote a healthy life, or more on towards wellness, which sort of ensures that the load on the healthcare, the curative medicine, is lower. Again, it is also large addressable population for the business to consider when they're looking at wellness as a sector. I think when I was looking at wellness, what wellness means, it's a very interesting dimension, because the wellness for urban population is very different than the rural population. Of course, there are areas where there are, where they intersect, but largely the urban population today is more looking at how they can be physically fit, how they can look at preventing lifestyle diseases or deferring lifestyle diseases, focus on mental health, yoga, healthy food. So those are the segments you will see a lot of investments happening. On the rural side, whereas the wellness is a lot more on primary health, how can we have a better primary health support services, focused on better sanitation, nutrition to mother and child, education on hygiene, how do we minimize the communicable disease. These are some of the segments which the wellness can definitely cover, and that's the need of the hour. What we see today is government spending a lot. Yes, the government has created multiple initiatives. I think today everybody has heard Ayushman Bharat, whether it's the insurance cover for significant population, which is accounting for 50% of the population, whether it's the Ayushman Bharat, infrastructure initiatives to strengthen the overall healthcare infrastructure, or promoting the primary healthcare centers to healthcare and wellness centers, and I think Mr. Gaurav also talked about the digital Ayushman Bharat digital mission and building an interoperable digital healthcare ecosystem, which can definitely advance the focus towards wellness, because then you'll have better data of the population. There are multiple other initiatives. I'll not go more in detail. I think I just want to touch on a couple of others. There's also, telemedicine. There's a significant emphasis on telemedicine. There are, platforms for doctor-to-doctor consultation, doctor-to-patient consultation, which also drives the agenda on availability and accessibility for the wider population. There's significant focus on alternative or the traditional medicine. The Heal in India project emphasizing on medical and wellness tourism, and of course the Ayush as a program. The market size is USD 18 billion. On the Ayush as a market, and there are multiple SOEs which have been MOUs which have been signed by the government with various agencies to promote the traditional medicine, which is a segment of the wellness. So the government is doing a lot. Is it sufficient? The answer is no. We need a lot more funds for it to be a sustained initiative. I think that's where we should actually look at how the private segment can pitch in and what can be done better to optimize the utilization of the funds. Of course, some of the initiatives like the National Digital Health Mission itself give opportunity for a lot of private players to see how they can augment on the platform and provide various services. That's on the government side. I mean, if you really look at today the economy or the market size of wellness, if you read through, the wellness as a segment has multiple numbers, multiple growth percentages. That's because the segment is not defined which is not standardly defined. So you'll see the numbers very different. But I think the bigger picture is as a segment, it's definitely growing. It's a segment which will continue to grow. Just few dimensions in India. I think the expected CAGR on wellness is around 20%. The global market is 5 trillion on the wellness, of which we have moved from contributing 0.25% to 4%, and there is definitely more to contribute. Around 40 startups which are focused on wellness have received approximately 1 billion investment in the last 3 years. So there is a lot of capital. There are private equity or venture capitalists who are interested to invest in this segment if there's a good business idea. Now, what it can mean in terms of the areas, whether it's primary health, diagnostics, med devices, there's a fundamental shift in mindset of people from patient to consumer. What it brings in is how businesses can help in improving the physical fitness, the mental health, digital tracking of vitals, the smart devices. There is a significant opportunity to leverage technology to bring in a more online consultation, to bring in predictive analytics to ensure the advance the agenda of preventive healthcare. Of course, home healthcare. India has a significant young population, but there is also a reasonably large senior population, and it'll become as it'll grow further. So how the private players can focus on home healthcare, and last but not the least, for all this to work, there's a need to train the people, need to train the service providers on all these elements. So how somebody can work on this. I think these are some of the areas. This is not exhaustive. I've just given some dimension, and I just thought I should also give some history. I mean, you will really see the graphs here on how the investments have happened in the last 3 years. You will see the two big pillars. Let me see if I can. I think it's difficult for me to put a. Okay, so you'll see the pharma and biotech is one of the large pillar. The health tech is also significantly large pillar. So there is going to be a lot of investment. The history is there to say that, okay, there's a lot of interest and we'll continue to see investment. So if there are good ideas, I'm sure there is enough capital to back it. That's one on the industry, but I think the India Inc., the corporate, what can they do even if they are not in the healthcare sector? Today, I think the CSR funds, it's a big money, a large amount which can be considered for deployment in the wellness initiatives. In the FY21, around 26% of the CSR expenditure, which is around 5,720 crores, was dedicated towards funding healthcare initiatives. Of course, there's a lot of CSR funds get deployed on education and child development and many other things, but there is definitely this is a good money which can be for invested towards the wellness, and we have been helping many clients on how they can devise a strategy around it, deploy the funds as well as monitor it. I think this is something for everybody to think through. I just give that as a last one. I think I want to more cover on what are the opportunities for collaboration. Of course, there is definitely there can be more investments, technology support in the area of health tech, med devices, and various initiatives from the private side. On the traditional medicines, how can we promote, how the collaboration can promote Indian traditional medicine in the global market, how we can promote India as a center of Ayurveda, yoga, and other, the traditional medicine wellness initiatives. And there are many joint programs on various aspects. I'm sure there's a speaker on this aspect who will go more in detail. There's a lot happening. More can be done. I'll probably leave that as my last one. I've used various sources of information. I'll probably leave this. I think the last, when I really look at the biggest innovation which can happen in healthcare is how we can move from sick care to well care. This is one of the big code when I picked up when Graham Thornton did a research in US on what is the biggest innovation the sector needs. I'll probably stop it there. Thank you. Thanks for a patient hearing. I hope I have motivated few people to invest more in the wellness segment to shaping a more vibrant Bharat. Thank you.
Thank you, Bhanu. And you have really well written, sick care to well care. I really appreciate this. And same time you have written these slides are property of Grant Thornton, but I would love to get these slides because it's very impressive and same time very valuable. So thank you so much. Now, before I invite my another speaker, I would like to say that kindly make your talk crisp so we can listen all three more speakers here, and our guest of honor Pritha ji is also here, so we should listen to her. So now I would like to invite Mr. Dheeraj Jain, founder Redcliffe Labs. Dheeraj Jain is the founder Redcliffe Labs with the vision of building truly a pan-India most advanced diagnostic platform, affordable to all. Today, Redcliffe Labs is backed by major impact and world-class long-term investors to build and scale Redcliffe as an institute. In a span of 2 years, when it entered into routine testing, it has taken the spot of India's fastest growing pathology organization, collecting and processing samples from nearly 10,000 families every day across 120 plus cities, largely home collection through digital channel, but also across 700 collection centers. Redcliffe Labs over the last 4 years has built comprehensive portfolio approach, both with routine and specialized test menus with advanced testing labs all over India. Its digital first approach with an on-demand 1-hour home collection and same-day report is disrupting the way diagnostic is delivered today, and thus is the fastest growing in India. Redcliffe Labs is providing 3,500 plus tests across its wide network of labs and collection centers. The test portfolio is very wide, including routine pathology tests, advanced genetic screening, research-based DNA test in reproductive health, cancer, and wellness fitness. The easy-to-interpret smart reports provide key health checkpoints, helping diagnosing and treating both chronic and acute disease on time. With presence in 120 cities, Redcliffe Labs has 30 plus advanced laboratories equipped with the latest technology to ensure 100% accurate and clinically reliable test results on time. Redcliffe also owns Crysta Ivf, one of India's most trusted network of fertility chains that provide world-class treatment to help couples start their families. The company is on a mission to make fertility treatment easily accessible and affordable through its wide network of accredited IVF doctors and well-equipped centers. As a graduate in science, Dheeraj started his career during 2001 in management technology consulting in London and moved to Finland with Nokia in 2002. Where he spent 9 years across major functions and was groomed as next CXO. He did his MBA at Cass Business School, London. He left Nokia in 2011 and thereafter worked in leveraged buyout market in London and New York. Mr. Jain has also been credited with creating an active mid-market LBO market for outbound Indian MA and AS. He returned to India while building his own early stage investment portfolio of 50 plus and now many successful startups. He was known as most prolific angel investors of 2016 by Economic Times during 2017-18. He also co-created the renowned brand Peace Safe around women health before starting Redcliffe Labs. Dheeraj was guest lecturer, City University, London, and invited speaker at Ross Business School, Michigan, USA. He was awarded Bharat Gaurav Award in British Parliament in 2015 for his impactful work across domains. So Gaurav, so Dheeraj, really when government of India is trying to remove TB from India, so diagnostic chains are playing a major role in this. So now I invite you to share your views. Dheeraj.
Thank you. Thank you, Pasnaji, and thank you for an amazing introduction. And thank you, Gaurav, my co-panelist, and Bhanu. I think some of your words, and Bhanu, the insight you gave is absolutely amazing. As this is an Indo-US panel, let me thank you, the US counterparts, if they are in the group or who are listening. We use technology from Roche, Abbott, Illumina, Thermo Fisher, and all these four companies are major mammoth in terms of building R&D in healthcare technology. And Recliff is probably one of those companies who have taken the last 2 decades of advancement in both molecular science, biological synthesis, and also pathology, routine pathology, including hematology and immuno and biochemistry, bringing to India in some of the recent new machines, which all of these vendors have launched. So while I'm not promoting any vendor, but I'm just trying to bring the US plays a very, very important role, even in the Indian healthcare, in the indirect way by bringing some of these technologies. So thank you for that. If anybody from the US medical or healthcare industry in the panel here or listening. I think clearly the biggest change, and I think we all know that the biggest trigger point could happen in economy, could happen in civilization if some big event happened. And I think all of us have gone through that big event of COVID pandemic. And what we realized that pandemic, not just the first wave, the second wave literally opened eyes for everybody. There were deaths in the neighborhood. There were deaths in the family, unfortunately, who suffered that. There were fatalities in the corporate side of the things for people who were working together, who were especially in the healthcare industry, even in the front lines. I think the pandemic opened eyes like never ever before. And I think that event not only disrupted supply chain, which is why we are facing inflation right now, but have actually disrupted consumer mindset. And that shift has happened for these families thinking that tomorrow, what if this happens to their family? What if this pandemic in a different version comes in? Because the COVID virus could continue to mutate and continue to bring surprises, as we are seeing right now in China, which is still suffering. And therefore, if this comes back again, what this really means to these families, and will these families would comorbidities, which is, I think literally we see even in extended family, pretty much in every single house, there is some chronic disease. And how do they fight that? And I think, and that is the biggest stress for consumers. So I think in the real terms, and that mindset shift is where both the government and the private companies should take an opportunity to go and make these people aware. I don't know if largely people know that, but in the industry, 4 out of 5 families have never tested before, have never taken a diagnostic test. So for a penetration of this kind, the opportunity is amazing. And this is not purely on, full body checkups or, vitamin deficiencies or allergies and all of that tests, which a lot of urban India do, but largely also on the chronic side, especially diabetic. India is a capital of mostly all the diseases. I mean, we are the capital of diabetic, thyroid, non-communicable diseases, things like hypertension, then, cancer. We have the largest number of rare disease in India, largest number of impact on the rare disease in India, both as an absolute number and a percentage, similar for oncology, for cancer. But then goes on to pregnancy. We produce more babies than anywhere in the world. We have more infertility. We have 30 million people suffering from infertility, 27 million babies born every year. Pretty much you look the landscape of any disease type or any situation which requires healthcare, India turn out to be the massive volume in pretty much everything. And therefore, and if 4 out of 5 families have never tested before, you can see what is then that opportunity. And I think that is the opportunity what Recliff imagined pre-pandemic, that this is the time now to go and disrupt. This is the time to actually make families aware. And just to give a little sense of the scale, what we do, we speak to 35,000 families every single day. We have 800 health advisor who speaks to these families across tier 1, tier 2, tier 3. And these conversations last for 30 minutes where they talk about their challenges and the background of, the disease they have suffered or believe could come up to them because, they've seen symptom of some of them. And how we could do a test? I mean, for us, the product and service is really the testing and consultation, but how can we actually do and pick up this sample and still able at an affordable price, still manage to give them insight? And that is just unbelievable. I mean, today we go to 6,500 homes every single day. First sample get collected at 4:50 a.m. in suburb of Mumbai this morning. And a lady collected, by the way, that sample. So we have women phlebotomists actually going out there and collecting these samples and bringing by 10:30 a.m. 80% of these samples are in the lab, collected from 140 cities. And 100% of these people would have never got this collected 2 years back, any of these things. So this is a new India, new Bharat waking up, saying today I need to really look after me and look after my family. And not just for diabetic, not for cancer, not for thyroid. I mean, these are basic consumer wanting to know even their lipid profile. We are making content, videos in so basic local languages and to make them understand why these are relevant for them now at this age, maybe at a later stage. And using content, a digital adoption of 900 million consumer who have the lowest cost on consumer data, and actually them accessing these kind of content to actually convert that conversation into something more meaningful, which impacts their lifestyle, then to a test and collecting this every single day. Started with 0 2 years back to this kind of a scale can only happen not because we are pushing, it's actually the awareness itself is open up. And what have also changed is the affordability. I mean, Bharat still, no matter, where we talk about urban India, the Bharat still is making tries thinking about it when it actually access anything, which is not the food and the beverages and education and other basic things. I think for healthcare is still not that same priority as it should be. But making it affordable have changed that landscape. To all the companies listed in this space still, are on those thinking that these price thing will come and will disappear. But I think for Bharat, this will sort of not disappear. This is here to stay for a very, very long time. Today, we have made these packages affordable, as low as 400 rupees to consumer who can still do 40 tests, sitting in Raipur, in a city near Raipur, in Rewa, in Madhya Pradesh. We have actually gone into Rewa, a smaller town, and actually created 11 collection center and actually collecting sample from home and have made up a lab in a hospital with a HLM model. So tier 3, tier 4 of Bharat have kind of ready for this disruption. And I think as Upasana, I really like what you said earlier before the panel, that we can keep talking about certain things. We can bring in insights, but these insights are completely irrelevant if they don't take action around. And I think at Redcliffe, we took this opportunity that this is a time to disrupt the mindset and leverage that change pandemic have actually bringing the fear, which is still there. And what is the fear? Just from a number perspective, India spent on the diabetic, from a prevention perspective, I think diabetic patients spend $6 billion. Pre-diabetics spend $2 billion, $8 billion spent on diabetic in total from a patient outcome. This is projected to go to $20 billion just in 3 years' time. And if we could actually bring this prevention mindset by doing more pre-diabetic checks from a testing and counseling perspective, the total spend will, by the way, reduce to only to $14 billion by doing this thing. Similar thing applies also on the cancer. So the opportunity to disrupt, by building things which are easier. So we look all of these 3,500 tests and make simpler packages for consumer and these patients to understand, to adopt, to connect to their lifestyle, and then the tests more regularly. Some of these people we test are coming back to us every second month. Some are coming every fourth month. So the amount of repeats we are seeing by making it affordable and going deeper into Bharat, going accessible by 40 labs we have today, bringing another 60 labs in the next 8 months' time. Very bold step, bold moves, real impact, and amazing outcome. The data we collect every single day, on every single Sunday, just on the preventive wellness, wanted to mention, every single Sunday in 140 cities, we do 1,200 camps. health camps and speak to more than 15,000 families who we enroll, and then we speak to much larger number of families, and these 15,000 families do at least 80 tests, and nearly doing 500,000 tests on Sunday, a practice which never existed before. And we took a pledge by 2024 Independence Day, Redcliffe will do 10,000 camps in Bharat at least build up that kind of a average run rate on every Sunday, but on Independence Day. So I think big moves, real moves, and you can see real impact. The technology has been existing for a very long time. The execution of this scale and this mindset is very, very rare. And that's why when we look at our counterparts, there is obviously a large commercial outcome. You know, we are a very sizable, we are the 4th largest diagnostic company by doing all of this. There is a big commercial outcome for our investor, for our shareholder. But I think the real outcome is that impact. And this is what really makes us very, very different. But we cannot do without the ecosystem. And this is a great opportunity in the panel today to kind of come together and do more of these and go build up more deeper sort of case studies and sort of bring it to other players also who are in pharmacy, who are in hospital, and see how diagnostic of this kind can make a real.
Clinical Director, Peerless Hospital and BK Roy Research Center. Clinical Director at Peerless Hospital and BK Roy Research Center, NABH Assessor, won an award in patient safety, member of various national and international associations. He is an MBBS doctor with specialization in clinical pharmacology, PG diploma in clinical endocrinology and diabetes, 14 years experience in medication safety, healthcare quality improvement, clinical trial operations, phase 2, 3, and 4, pharmacovigilance, medical affairs and clinical development, medical information, and recognized for medical writing expertise as author and peer reviewer of scientific papers on diverse topics on clinical pharmacology, pharmacovigilance, and clinical research. Consultant for Digital Health Program at Maulana Abul Kalam Azad University of Technology, and Honorary Lecturer Institute of Clinical Science, University of Birmingham, UK since January 2020. Successfully lead clinical research departments as medical expertise personnel in 2 tertiary care hospitals, served as primary contact for research participants, sponsor and regulatory agencies at those sites. Successfully participated in clinical trial projects as co-investigator and sub-investigator and completed trials within timeline as per protocol. Successfully functioned as the member secretary of Institutional Review Board of 400-bedded multi-specialty hospital and managed the day-to-day operation of Ethics Secretariat. Functioned as member Data Safety Monitoring Board for monoclonal antibody trial in oncology. Faculty and core member of 10-member Indian national team for drafting of clinical trial accreditation standard for India, only member selected from eastern part of the country. Assisted in preparing drug development plans to secure regulatory approval in Indian market for Pfizer in India. Trainer for ICH GCP principles for investigators and ethics committee members across different hospitals in India since 2010. Winner of the ISCO Lucian Relay Patient Safety Fellowship Award 2019, co-authored a chapter on regulation governing clinical trial in the book Fundamentals of Clinical Trials and Research, first edition 2012. So now I would like to invite Shubhrobhoti Bhaumik, Clinical Director, Peerless Hospital. Please, Shubhro. Actually, I was not aware that you are doing such a great job. We know that you are a very dynamic person.
Thank you so much for that wonderful introduction. It's an honor to be in this panel with this august panelist, and most importantly, ma'am, to be in front of you because we are very proud of the work which you're doing. And I thank the Indo-US Economic Summit organizers, especially the Chamber, for inviting me here. Madam, if you allow me, I will just have few slides which I want to talk on a topic which might just provoke some thoughts. I want to leave you with some thoughts. Yeah. So just allow me a minute. And please let me know if my slides are visible.
Yes, very well.
Thank you. So good evening to everyone. And I'm going to talk about a topic which is very close to my heart because as a clinician, we see a lot of chronic smokers. And as a patient safety expert who has trained not only in India, but also in the US. So I had the opportunity to work in the United States at Stanford University School of Medicine for 3 years. And I've known the culture in which the US hospitals function. So I'm here to talk about the patient safety options in chronic smokers. And again, thank the organizers for this opportunity. So what is the problem statement of smoking? India is actually it has a large number of smokers and tobacco users in the world. We are almost 267 million tobacco users are present in our country, and we are the second most number of smokers in the world after China. Smoking kills, we know this. Our movies tells us about it, but how much? It has killed more than 1.2 million Indians per year. So ladies and gentlemen who are scared of COVID, let me tell you, this is a pandemic which is also happening in India. It's not only nicotine which is responsible for killing in smoking. Many people don't know that the tobacco smoke produces a lot of toxins and carcinogen, and these are harmful and potential to cause cancer and ultimately death of patients. So what is the thing which we need to do when a patient comes to us with smoking? We use smoking quitting therapies, but are they successful? You look at the statistics, only 5% of the men between 45 to 59 years of age are ex-smokers, means they go back to smoking again. We have a large number of nicotine replacement therapies in our country and in the United States. But the literature coming in from both our country and the United States tell us that most of the nicotine replacement therapies, they are not continued for a long time. Number one, because of side effects, the cost is very high, and ultimate result is relapse. The tobacco centers are located in the urban areas, the tobacco cessation centers, and as one of my previous speaker has pointed out, there's a great divide in our country. So we need to actually have more tobacco centers, cessation centers in the rural areas, because it's very difficult to reach these population and they easily lose up to follow up. So what is the element which kills in smoking? It is the heat. If you look at a cigarette, the smoke which this tobacco produces is burnt at 600 to 900 degrees Celsius. And this is not something which I am saying. It is being published in the literature. So the end of the cigarette is actually that hot. And more than 6,000 constituents are identified in the tobacco smoke. And of these smoke, many of these constituents are carcinogenic. But what has the literature said is this heating, which is the main culprit for producing this carcinogenic things, happens less in e-cigarettes. So tobacco reduction by tobacco harm reduction methodology is a concept which is practiced in the United States and other developed countries. And what does these developed countries do when they actually promote tobacco harm reduction? They have brought in this novel concept with the thought process that eliminating smoking from society probably will never be possible, because the measures to reduce harm have to be implemented at individual level and at population level, because recurrence is very, very common in this addiction. So there are different options which are offered to these chronic smokers, including the e-cigarettes and the other vaporized products like the low nitrosamine smokeless tobacco, which I'm going to talk about in the next slide, in a country like Sweden. And this tobacco harm reduction empowers smokers to gain control over the consequences for their nicotine addiction. What has been the experience in Sweden? Sweden is one of the countries with a large number of smokers, and incidentally, Sweden also has a large longevity after life. They have introduced this particular product known as the snus, and in that country, snus is a smokeless tobacco product which has resulted in many former smokers to quit smoking. The Swedish experience has been replicated in the neighboring country, Norway, as well. Because both these countries, which have very strict regulations, they believe that snus reduces the risk of lung, oral, gastric, and cardiovascular cancers, along with cardiovascular disease, which we relate to smoking. The tobacco harm reduction with e-cigarettes, if I could mention, studies indicate that the e-cigarettes might potentially lead to significant reduction in exposure to harmful substance as compared to conventional smoking, as I mentioned, because of the increased heat which happens with conventional smoking. And this concept is well available and adopted in countries like United States and in the European Union. So what happens in the heated tobacco products? The heated tobacco products have controlled heating, which in combination with uniquely processed tobacco prevents combustion from occurring. And the temperature, ladies and gentlemen, is kept below 400 degrees Celsius. If you remember my last slide, which mentioned that in a conventional smoking of a cigarette or a bidi, the temperature will reach 600 to 900 degrees Celsius, where the carcinogens are emitted. Whereas where you're keeping the temperature around 400, the carcinogens don't get emitted. The tobacco harm reduction with heated tobacco products, what is the literature talking about its safety? The analysis of these products have been done by the WHO study group on tobacco, and they have found out that the important carcinogens, including the aldehydes, the volatile organic compounds, were reduced by about 80 to 99%. As compared to the cigarette smoke, the various carcinogenic agents levels have been reduced also. And the most notorious polycyclic aromatic hydrocarbons, these are the agents along with carbon monoxide, which cause cancer and also causes the COPD in patients. They have been reduced by more than 90%. Let us look at the experience of these products from across the world. Let us go to this country, Japan. Japan has the largest longevity of life, and it is also, unfortunately, the largest global market for cigarette smokers. Japan has introduced these agents which account for 85% of the global market. And if you look at between 2011 to 2016, after they have introduced the e-cigarettes, yearly decline has happened for 2 to 4%. Whereas in 2015 to 2019, there has been an increase of 5.1 billion sticks to 37.1 billion sticks of e-cigarettes. Does this mean smoking is increasing? No. The significant decline in cigarette sales from 2015 is likely because there is switching over of the chronic smokers from the harmful cigarettes to these products which have been introduced in Japan. In 2018, the Japan National Health and Nutrition Survey clearly showed that among those who use the heated tobacco products, 70% of them have switched from chronic smoking in the chronic smokers from the conventional therapy to the heated or the non-conventional therapy. There has been a huge hue and cry that e-cigarettes will increase the usage among children in the country. But what is the Japanese data saying between December 2017 to 2018? The evidence from Japan is clear that the availability of these products has low impact on the initiation of tobacco use among the never smokers or re-initiation by the former smokers. Let us go to the United Kingdom. The e-cigarettes are used as a safer alternatives by the United Kingdom, and it has been endorsed by the government and medical professionals, and also has been endorsed by the Public Health England and the Royal College of Physicians. The government policy in UK mentions that it wants to help people to quit smoking by permitting innovating technologies that minimize the risk of harm and maximizes the availability of safer alternative to smoking. Canada, the Another country, which is neighboring country of United States, allows heated tobacco products, and they are regulated under the Tobacco and Vaping Products Act. And the heated tobacco products are subject to the same restriction as other tobacco products. If you look at our partner, United States, the United States has policies, and very crystal clear policies in the healthcare policies, and the government policies about the tobacco and nicotine regulations clearly mention that harnessing new forms of nicotine delivery that could allow currently addicted adult smokers to get access to nicotine will be allowed. And in July 2020, the FDA, which is one of the most regulated drug and device regulating agency in the world, mentioned that it has authorized the marketing of the heated tobacco products as a modified risk tobacco product in that country, with the claim of reduced exposure on the basis that they could be helpful to addicted adult smokers transitioning away from combusting cigarettes, because I mentioned the combusting cigarettes, they produce a lot of carcinogens. What is the role in India? India, as I mentioned in my presentation, has huge number of tobacco smokers. And what is the situation of the heated tobacco products in the country? India banned e-cigarettes in 2019. So should we ban all forms of tobacco in our country or consumption so that we can ensure long-term safety to all citizens, including the chronic smokers? I acknowledge Dr. Vishal Nagdev for helping me do this presentation. And before I end, I would like to invite you all to this unique medication safety conference, which we are holding in Kolkata, because this is a run-up to the World Patient Safety Day on 17 September. We are very honored and happy that Professor David Bates, the chief of Harvard Medical School, is going to be one of our speakers, along with Dr. Neelam Dhingra, who is the WHO Patient Safety Chief, along in this conference. Please come and join us in this medication safety conference in Kolkata. Thank you very much for this opportunity. Thank you, ma'am.
Thank you so much, Shubhro. And I would like to get your slides, because
Sure,
these are useful and we can spread in our groups and we can discuss in different forums. So now I would like to invite my guest of honor, Dr. Preetha Rajaraman. I was eagerly waiting to listen to you, Preetha. Dr. Preetha Rajaraman, Health Attaché and South Asia Regional Representative for the US Department of Health and Human Services, served as a key advisor to the US Secretary of Health and Human Services and the US Embassy in India on matters involving health and biomedical research in South Asia. She is responsible for in-country representation, monitoring, and coordination of the policy, program, and interest of all HHS agencies, including the Center for Disease Control and Prevention, the US Food and Drug Administration, and the National Institute of Health, over a broad portfolio spanning health policy, non-communicable and communicable disease, health safety and security, and research and innovation. Dr. Rajaraman previously initiated research program and policy at the US National Institute of Health's National Cancer Institute, where she received the Director's Award for Exceptional Leadership, fostering cooperation in cancer research between scientists in the United States and India. Her research on the interaction between genetic susceptibility and environmental force factors in cancer has resulted in over 130 peer-reviewed publications. She is an expert advisory member of various international bodies, including the International Commission on Radiation Protection, the World Health Organization, and the Lancet Oncology. She holds a PhD in epidemiology, Johns Hopkins, an MSc in environmental health, University of Washington, and a BA in biology, Reed College, Phi Beta Kappa. Really, Preetha, you are doing a wonderful job for both the countries, and we are really thankful to you. Now, I invite you as a guest of honor, kindly enlighten us from your wisdom of words.
Thank you so much, Pastor G. Great to be back on the panel with you. As you say, we meet again and again on virtual forum. And many thanks, of course, for inviting us to join. Listening to all of our other speakers. already heard earlier today from our Chargé, Patricia Lucina, and she talked about the growing importance of the US-India relationship overall. And so I'm really delighted to be able to take one part of that relationship, our health and biomedical relationship, and talk a little bit about what we are doing in that space. I think many of you already know that our two countries working together to address both new and emerging health threats as well as old ones. It's not new at all. In fact, if we really think about informal collaboration with health and biomedical research, it goes back centuries through exchange of our experts, our knowledge, building institutions together jointly. But our formal collaboration actually is as old as this country itself. It's 75 years. Right when India was established, I think we started collaboration company. If you just think of some of the areas we've collaborated on, certainly both our U.S. health and development agencies have worked very closely with our Indian counterparts to bolster pandemic preparedness, long before this pandemic rolled around. And part of that was strengthening the health systems. And a lot of this was done with our CDC, as you mentioned earlier. All of these activities, whether they're building surveillance systems, lab detection, strengthening the health workforce, have really increased significantly over the past couple of years with the COVID pandemic. Not only to battle the pandemic, but to simultaneously prepare for the future. One area that has really come to light specifically in the last few years. I think it's been sort of happening under the radar for more than 35 years now, but we've really seen some of the fruits of this labor has been our collaboration jointly on vaccine development as well as procurement. And if you look at all of our agencies, whether that's our Assistant Secretary of Response, CDC, NIH, FDA, all of these agencies have actually been involved for many, many years in the development of vaccines here in India, both for infectious diseases and also, people realize less that we do have some communicable diseases that we're working on as well. Whether that is vaccines for the prevention of HPV, cervical cancer, or other cancer. So, we've had from the program, through which we are addressing several diseases, including tuberculosis, dengue, other emerging global threats. But I think one of the things that we've been very proud of is that the first vaccine ever developed in India was developed jointly with all of our agencies, but also our private sectors. Against rotavirus, which is a common disease. And then, one of the great things about our work here in India is it sort of spans all the way from kind of the development, as we did for vaccines, to the delivery. And agencies such as our U.S. Centers for Disease Control, our CDC, has worked very, very closely with the government of India and other partners to support the delivery of those vaccines and, certainly other technologies as well, which includes strengthening supply chains, addressing misinformation, vaccine hesitancy, training healthcare workers to deliver these measures safely and effectively. A few of our speakers mentioned the U.S. Food and Drug Administration, and of course, they continue to share information and best practices with the Indian government on the regulation of food and products. Certainly, in terms of import lines into the U.S., India is number one. So this has substantial, I think, impact for us in the USA, but also really globally, since there are two parts to this work. One is for our U.S. market. One, of course, is for the Indian market. But then there are so many licensing agreements and generic producers that are really producing for the rest of the world. and so of great global importance. If we sort of look back just over the last 2 to 3 years, all of this collaboration really came together in our joint response, certainly to COVID, but also for global response to COVID. And again, if we just take one example, but there were many more, if we look at the globally available vaccines for COVID-19, several of those really involved US-India cooperation. And again, this has greatly expanded the reach of vaccines, not only to our 2 countries, but globally, and will continue to do so. So in addition to this work on COVID, of course, we have always collaborated on and will continue to collaborate on a variety of both non-communicable diseases as well as communicable diseases. One of the things that became very clear, and again, I think one of our speakers alluded to previously, is even though COVID itself, of course, is an infectious disease, it became very, very apparent very quickly that it highlighted how closely our infectious diseases and whether that is the individuals who are at risk for COVID-19, largely being people with underlying conditions such as diabetes, cardiovascular disease, but also increasingly as we monitor the progress of people who've recovered, the long-term sequelae, and that's both neurological, digestive, respiratory, and also very importantly, this much more invisible sequelae, which is the mental health. Initially, I think during the early stages of the pandemic, we saw this as anxiety and depression. But now it really has grown into a broader problem in communities as well as individuals. So I think, as we move forward and think about our collaboration going forward, it's very clear that from the medical perspective, we're going to have to address all branches of medicine as essential components in care delivery. And again, the focus is on high quality, accessibility, as well as how inclusive is this care. This in turn feeds into much broader, multifaceted system, which includes preparedness at various levels, whether that is strengthening the healthcare system, as we have been, whether it's improving the actual infrastructure of healthcare, whether there are policies at the government, state, national level that can help address these, certainly increasing manpower, training, and very, very important leveraging innovation for all of this. I'm so glad that many of our speakers before brought up examples of this, whether that is in digital healthcare, telemedicine, creation of new drugs and devices, new delivery systems, because all of these feed into making sure that not only the medical care itself, but also the delivery of affordable vaccines, therapeutics, and devices get to every section of. So, I'm just going to end by saying that for each of these sectors that we've gone through, the private sector can be and should be, and often is, a crucial partner. This is not really only within the health sector, but it's across multiple sectors that impact both prevention as well as our livelihoods. When we think of health as being broader than just physical health, but really our well-being. In fact, if we've learned one major lesson, and we've learned many over the last 3 years, I think the key one is that preparedness and response require flexibility and creativity, but also collaboration across multiple sectors. So we really look forward to towards building back better, to work with all of you to help build a better, healthier, more resilient.
Thank you so much, Preetha. As you very well mentioned about that how we should work together for better healthcare for all. So this session was a very everybody just suggested different things. So it was a very wonderful session because no repetition was there. Everybody was talking about something different. And as I said in my welcome note also, that India and America, if we work together, we can actually create wonders in healthcare. As Preetha, you talked about mental health. So India can help a lot in mental health because our yoga and meditation helps a lot if somebody is in depression. So with these words, I am really thankful to you that because you are so busy. I know everybody knows that your schedule is very busy, but still you have given time to us. So I am thankful to you, as well as I am thankful to all my speakers who gave us time, and much thank to those who has joined us. 5,000 people are listening to us, watching to us. It's a wonderful event, and I am really wishing all the best for everybody. And I think India and America can work together for eradication of tuberculosis as well as other diseases, and we can create not only healthcare, now we should focus on wellness also. So we should work together for wellness. With these words, I will close this session, and I am really thankful to all, and a special thanks to Indo-American Chamber of Commerce who has organized this wonderful session.